Welcome everyone. This is our weekly meeting here with our head resident, Kylene. And the discussion this week is how to treat neck problems, which can be very problematic, and how to treat hip problems. So first up is the neck. So Kylene, what's the specific question?
Okay, specific question is patient is having a difficult time turning to either the right or the left, the lateral rotation. So, they can't even move to the right or to the left. Severe pain along the occiput, and inability to move. So, and patient wants to be helped immediately.
Okay. If you take a look at all the different muscle groups going into the neck, there's a lot of them. There's the oblique capitis, the oblique inferior and superior. There's this splenius capitis, there's scalenes posterior, there's levator scapula, there's the trapezius muscle, the rectus capitis, lateralis, semispinalis capitis, longissimus capitis, and the SCM. All of those are involved with rotation. And it turns out that all those muscle groups are either fed blood through the UB vessel or the kidney vessel. The only difference would be the levator scapular, which is a small intestine vessel. And this is why if you are practicing the balance method of Dr. Tan, then of course what you're considering the body is covered with are energy meridians. And the classical energy meridian going up through the neck is the UB channel. Well, you can see that all these muscle groups, it turns out, they're all fed either blood by the UB vessel or the kidney vessel. And so if you target the UB, you'll get a good result. The question is, where do you needle? And we've been at this many, many years. And so we'll try to shed some light on how to quickly get this neck problem to release. First of all, yes, there is a problem in the muscle group, but there's also a problem in these little facet joints of the spine itself. So your first needle should be into a joint. And that joint should be something that would treat the kidney vessel or the UB vessel. So that your choices are down on the foot, you can stick a needle in at kidney 6, find that hole there. You might have to use 3 needles. You'll find the hole where the needle will go all the way in. And that will have quite an effect, okay? Because the kidney treats itself, and of course the kidney treats the UB channel. So now you've covered every single muscle group, and the joint of the neck, the joints of the neck, and the only thing you left out was the levator scapula, but everything else is covered. So you do that, then you get a 3-inch needle and you put it behind the kneecap, underneath. From UB40 you go up, all the way up, thread it all the way up till you hit the back end of the kneecap, and that way you're getting thoroughly into the UB vessel, okay? And if you go from the side a little bit, you can enter into the knee from the kidney side, and then put that 3-inch needle all the way into the back end of the kneecap. That will cover all the kidney vessel and the UB vessel with one needle. You can use 2 of these 3-inch needles on both sides. That will have a dramatic effect of freeing up the neck. Okay? So use that kidney 6, get it deep in the joint on both sides. Use 3-inch needles on UB40 on both sides, maybe 2 3-inch needles per knee, and then see how it works. That should take away your joint problem. Then the rest of it's just a muscle problem, tight muscles. And for that you'll needle muscle groups. And you can choose to needle muscle groups that are associated with the UB channel, and you can choose to needle muscle groups that are associated with the kidney vessel. Kidney treats itself, kidney treats the UB treats itself, and UB treats the kidney. So, there's other vessels you can choose, but this is basically what we do. So where is the neck? The neck is the hand, and the foot is the neck. So the hand is the neck, the foot is the neck. That's probably the best way to image it. There's other images, and I'll go through them, but that's the first one. So on the hand, which vessels will treat the UB channel? The small intestine and the lung. Which vessels will treat the kidney? The sangao and the heart. So that's what you want to do. You want to needle into the joints of the hand for the heart and the sangao, and needle into this, the base of the thumb right here. On the lung side, needle directly into that joint, okay? Needle into it, and then needle into the small intestine vessel around small intestine 4, and you can even add small intestine 5 into the joint. So you went into a muscle group on the hand, but you got into the joint as well. So you got both things, okay? Do that on both sides. You can go down to the feet, you can use kidney 2, and then you can put about 3 needles along the UB channel of the feet on both sides. This almost always will free up a neck, okay? The only thing left out is the levator scapular, which is a small intestine. You can use liver 2, 3, 4, liver 5 even, to treat the levator problem. The small intestine, by needling the small intestine on the hand, you also treated the levator because the small intestine treats itself. And then the heart treats the small intestine. So in effect, you did get the levator because the heart treats the small intestine, the heart treats the kidney, the small intestine treats the small intestine.
Would you image